Hi, I'm Dr. Messina, president of Dr. Undo Tattoo, and this video is going to be a little different than all the others. We're going to evaluate 5 tattoos with a medical theme, and we're going to rate them by quality of information that they give and the quality of the tattoo. So let's get into it. Number 5, penicillin allergy with a beautiful caduceus tattoo. Well, yeah, it's very important to know what your patient is allergic to, and penicillin being a mainstay of antibiotics. However, these days it's very easy to get medical information, and to find if a patient is allergic to penicillin is going to be pretty quick with a few clicks of a computer. So the amount of information it conveys is really not that important. The caduceus, however, is pretty darn cool. It's very accurate. Interestingly, that redness around it is a histamine release, so he might have a little allergy to his ink as well as penicillin. Let me just tell you about the caduceus, because I see a lot of things on it on the internet, but nobody ever explains the history. It's really cool. The caduceus, they think, came hundreds of years ago when people used to walk into wells that had still water in them, and a parasite would enter through little breaks in the skin in their legs. And the way you treated it was you put water where the entrance point was, and you put a little stick next to it. And the parasite would come out, wrap around the stick, and you would roll the stick and roll the parasite out. And like I said, it used to burn like crazy, and they called it the fiery serpent. So the original caduceus was a single serpent on a staff with flames behind it. And over the years, it evolved into 2 serpents on a staff with wings behind it. So now let's get to number 4, the love tattoo. I personally love the theme. It's important, and I think being happy and feeling love does help your health. And that EKG under it, really great. I think it was traced off a paper tracing of an EKG. It's just too darn accurate. That QRS complex is perfect. So why did I rate it number 4 if I think it's so positive? I rated it 4 for a technicality. You see, I know when I'm in love, my heart is pitter-pattering away. This heart rate is somewhere between 65 and 70. If they were truly in love, I would expect it to be 90 to 100. So some points off for the EKG being slightly slow. Let's see what we have for number 3. Here we have allergic to bee stings, no MRI in the left leg, and asthma. And just to avoid any confusion, there are actual caricatures. So we see a magnet with its magnetic pull, we see a bee with its stinger all ready to go, and probably an albuterol inhaler, all over a blood symbol that says A positive blood. So why did it rate this number 3? Well, first off, medically, believe it or not, it's not conveying that much information of importance. Number 1, allergic to bee stings. That's really not going to change your medical therapy. There's only one instance where it might. If someone gets brought in from an outdoor event or a park, semi-conscious with welts, swelling, looking like they might be having an allergic reaction, and you saw the patient has a tattoo that says allergic to bee stings, that possibly they're having an anaphylactic reaction to being stung by a bee outside. But outside of that event, not much information. Asthma, again, not much information. The staff is going to know you're having an asthma attack, and they're going to treat it. How about the blood type? A positive should be a good thing. Again, they're not going to rely on your tattoo if you need blood in an emergency. They're not going to give you the A positive blood. They're going to send out and actually get a retest and find out what your blood type is. And until that comes back, if it's truly an emergency, you're going to get O negative blood. So what is the important thing of this tattoo? The important thing is no MRIs to that left leg. Clearly, he has some kind of metal in that leg that can be affected by a magnetic force. It doesn't have to be a surgical thing. He could have had a car accident and have some metal inside his leg, or a war injury where it was too dangerous to try to take the metal out. So it's great information that he would let an emergency room know that there's something wrong with his left leg, that he can't get an MRI on it. However, he can't get an MRI on any part of his body. If you ever want to see something wild, try to find a video of an oxygen tank or something that can be affected by a magnetic field inside an MRI suite. It gets sucked into the cylinder fast and hard and it can't come out. It's not like a little home magnet where you're going to pull it off. So he can't go to any type of MRI. He could get a CAT scan, but with that in his leg, Now, as far as the tattoo goes, I didn't think it was that great. It's a little crooked, nothing matches up, and it's pretty big. I think it would have looked better if it was more in alignment and smaller. Let's see what we have for number 2. Type 1 diabetes over an arrow. Now this is probably giving the most important medical information, but the crappiest tattoo. That's why he's not in first place. A person suffering from type 1 diabetes is usually a diabetic since childhood. They require insulin injections several times a day in order to have the glucose enter the cells. They're also predisposed to a lot of medical conditions such as strokes, neuropathies, retinopathies leading to blindness, accelerated cardiovascular disease, and kidney failure. Plus, they're more adept to getting an infection. There's one thing, though, that the type 1 diabetic could have that is a true medical emergency, and that's the diabetic ketoacidosis. It usually occurs if they have an infection that they haven't treated, and they wind up with blood sugar very high. I've had patients in the 1,000 range. They lose consciousness, or they're very confused. They're profoundly dehydrated and have electrolyte disturbances. Now, if somebody comes into the emergency room that way, the medical doctors are going to quickly have to establish the etiology for this mental status change. Now, if they see a tattoo that says type 1 diabetic, that will help narrow the field, and it'll kind of help get the differential a little tighter. And that, let's check that blood sugar. Is he too high? Is he too low? Is he going to need some dextrose in his IVs because he's got an insulin pump running? So there's a lot of important information conveyed by saying on your tattoo, I'm a type 1 diabetic. So why did I hate the tattoo? I hated the tattoo because it was meaningless. It's on an arrow pointed to his wrist. I could see if that arrow was pointed to a chart, like a glucometer chart, and it could either be pointed to like 40 where he's too low or 250 where he's too high. But just an arrow like that is kind of meaningless. That's why he lost points. And now, number 1. This person was voted number 1, not only for the medical significance, but the quality of the tattoo. Plus, this guy's a survivor. We have a QRS complex, followed by a flat line, followed by a QRS complex. And in the middle of the flat line, we have a cross, kind of like a graveyard cross, and it says, not today. So this person either had a pause where he missed a few beats, or a moment of asystole where he had no beats at all. When you have a pause or an asystolic event, blood flow to the brain is cut off immediately. The brain doesn't store any oxygen. Therefore, you start to lose consciousness almost immediately. If it's not restored, you're going to get brain damage and you're going to die. So this person had their rhythm restored, and they seem to be doing well because they were well enough to order this tattoo and have this tattoo placed afterwards. So thumbs up to them. They're a survivor. They won this match. I hope you enjoyed this. If you did, let me know in the comments, and I'll find more medical tattoos and we'll evaluate them too. Take care.